It was definitely a challenging fire, a stubborn fire. We did successfully put the fire out. It took several hours. And we did have crews there overnight looking for hot spots. We did have some small rekindles and maintained personnel there throughout the day, off and on today, to check the site.
I kind of get the sense when the fire department first showed up, they were not prepared for what was on site. And so it's important. I know that data is available, but my question is, does the fire department have access to that data, and were they prepared? Did they have CO2, for example, which would have been more effective in fighting the fire?
The fire department did not know what chemicals were in that building when we were dispatched. We knew it's a chemical storage place, but we didn't know exactly what chemicals were on site. We do not carry CO2 for extinguishment. We have access to foam. We did use foam. Around 9:30 in the evening, we had access for our foam truck on the north side of the building. We used 875 gallons of foam, and it really was not successful. That is one thing we learned with this particular fire. The fire was so big, so hot, there was such an extreme volume of fire that the amount of foam we had available to us was limited in its ability to suppress the fire.
I cannot understand why a fire department with a city that has as many industrial facilities as Omaha does not have access to CO2. I mean, I just don't think that's appropriate. I also think that some reaching out to local residents to let us know what chemicals we were exposed to let us know what options we have if we do have symptoms and we don't have medical care, and also just to work out how evacuations can go more smoothly. Because I'm gonna be honest with you, most of us didn't know where the evacuation site was until after it was already starting to close.
The boundaries for the evacuation area could have been better, agreed. We created those boundaries based on our perspective from where we were standing. It was hard to tell from the scene of the fire how far that plume of smoke was traveling.
And I can tell you, I witnessed people east of 13th Street choking and coughing, having symptoms of their lungs burning. And it's because, in part, because the protective action recommendations were not changed and modified.
A lot of the chemicals that we're looking at, from what I understand, any health impacts are really dose dependent. So if you ingest a lot, it could be much worse than if you got a trace amount, and we just don't know at this point how much we're looking at on surfaces and things like that. So at this point, we have not identified any immediate threats other than what might have come from breathing in basically the smoke that was present during the incident. And we did ask that anyone who is having symptoms, respiratory symptoms, call their physician or visit the emergency room.
Emergency alerts went out in English only. And since that time, we checked with our vendor. In the future, all emergency messages, no matter what the incident is in Douglas County, will go out both in English and in Spanish.
This is definitely a cause for action, immediate cause for action, to put forth that environmental plan ASAP, as soon as possible. All of this communication problem that we have, all the unknowns that we have, where we can seek additional information, where can people go should they have respiratory problems, should they have medical problems, and not have the affordability to pay for those things. That would hopefully be all identified in this environmental plan. So that's the answer that I have to you today, that I will definitely be an advocate to push forth that plan coming to life.
I'd like to see a lesson learned task force, because this event could have been a lot worse.